So why do we have occupational stress? Well, if we were in person and I had a whiteboard, I'd be asking you all to tell me, like, what are the things about the work that get to us? And I think we'd come up with this list, right? I mean, certainly we're sitting with people in pain, we're sitting with people in distress. I know a constant worry for many of us is liability and risk management. We have to take all those courses, those ethics and risk management courses where they tell us all the horrible things that can go wrong, and you have to make these really tough decisions in tricky situations. Our role demands can be so variable. We are both a therapist, maybe also an assessor or evaluator. Maybe we see ourselves as a helper, but maybe in another situation, we're advocating for somebody else. Maybe we are both running a business and trying to help people, and those can be in conflict. I work in a hospital, so sometimes I'm clinical, sometimes I'm teaching, sometimes I'm an administrator, and I have to switch roles back and forth throughout the day. Sometimes there's a client that desperately needs me to call them, and I'm in meetings all day because I have an administrative role. So in my work with clinician well-being, this is one of my favorite tools for self-assessment and trying to decide if somebody else needs help. This is part of Stress First Aid, which is a model that comes to us from the National Center for PTSD. I highly recommend Stress First Aid for yourself, for looking at well-being for others. I'm using it a lot in my work with healthcare well-being. This is one of my favorite tools in Stress First Aid. It's called the Stress Continuum, and it just makes perfect intuitive sense. Green, yellow, orange, red. Green and yellow are those kind of normal sort of states we expect to have, that stress and distress. Orange and red are when we're getting into where action needs to be taken. So green is at our best. Green is where we're rested, ready. We might be challenged in our work, we might be stressed, but we're navigating it really well. We have the skills, the knowledge, the support we need to do the job well. These are those really good days. So even a really busy day at work when you feel like, wow, I did some good work today. I'm exhausted. Boundaries are probably one of the biggest wellness tools that we need. And I mean this in every sense of the word. So we need to think about boundaries around our work, boundaries between us and other people, boundaries at work, boundaries at home. So there's lots of places this can come in for us. And I like this, again, this is from that Norcross and Guy, Leaving It at the Office. Boundary implies a limit or territory that is not to be violated. The primary function of boundaries is to provide a safe and predictable environment for the patient to work and for the therapist to render effective care. We learn about boundaries as part of our clinical training. They're so important. They're kind of what makes therapy therapy, right? That makes it different than other relationships in our life. How do we take what we know about boundaries and apply it to other parts of how we interface with our work? So examples are, how do I separate life from work? When I'm home, how do I separate myself from work? What's my turn off mechanism? When do I stop thinking? Many of us are very good at telling our clients what to do for sleep. We have to take those seriously for ourselves. So these are some of those standard kind of sleep hygiene strategies we talk about. I am coming to you as someone who has struggled with insomnia off and on my entire life, including in childhood. I am much better than I used to be. And I've actually really tried to put my money where my mouth is and do some of the things I tell my clients to do, and they do work. Now, sometimes there's other reasons we're not sleeping, and we have to address those. So if you have a chronic health condition, pain, environmental factors, those things, of course, need to be addressed. But these are the things that if we get into the habit of doing these regularly, they actually can improve our chances of sleeping. Of course, if you are having clinical insomnia, these might not be enough, and it might be time to actually get treatment for insomnia. Prioritizing sleep is the number one thing. Get a bedtime, turn off the phone, the screens, the other things, get yourself to bed, and have a routine to relax at night and see if that helps.